Hello, and ladies and gentlemen, welcome back to my YouTube video channel. I am about to present to you another interesting orthodontist and general dentistry case. So let's jump right on. In this case here, I want to help you general dentists to have a better understanding how to approach certain case. How do you get from here to here? Okay, so the patient came to my office at the emergency situation where the tooth looked just like that. And if you evaluate the bite, there is a problem because the lower anterior is erupted, it's super erupted. And that's the challenge. Missing something going on here on the right corner, and we're gonna look inside her mouth. So this is the situation. She chipped and broke her all filling. And general dentist, all we can do is just fix it up and then it break again. So let's see how we approach and have it long lasting situation for her. So I want to go back to the video. I mean, the beginning of the presentation. This is a long presentation. Bear with me. So combination of cosmetic dentistry and orthodontist treatment in adults. My name is Dr. Lockwin, by the way. So your patient came to your office with this problem right now. Lower anterior hitting the upper teeth and chip A and 9. No matter what you're gonna do, if you don't do something permanently, this is gonna break again. So you can do a couple of things. Either you're gonna adjust the bottom teeth, put two veneer on, patient done. Then might be in the future it might break again because those two four teeth here really erupted. This is an indication of the deep bite, you guys, deep bite situation. Other problem that you can see is there's a little metal there. There's a little space missing here. Let's see what's going on inside her mouth. So again, on the right side view, there is missing the premolar here. Up super erupted on lower anterior number 24, 23, 24, 25, 26, super erupted. What does that mean? It's higher than the canine here. That's what it is. So normally when you finish the ortho K, you want these teeth 23 to 20, 22 to 27 somewhere aligned together. This is a little erupted because of the deep bite scenario. So you can see you put together lateral excursion or anterior protrusion. The number A, whatever you put there, you will chip it. The veneer will come out, or the porcelain will chip. It will just repeat the same thing. However, she came and she wants something immediately, so I went ahead and do something for her. Did some composite for her. I didn't promise her it's gonna last for a long time because I knew that the bite is off. And there's a language barrier trying to communicate with patient to make sure she understand this is permanent, not permanent things. So I convinced her that she needs to come back so we can do a study model and so we can improve her appearance. So noted that I didn't really want to shape too much and create too much of the anatomy of the teeth that she think that is permanent. So we just did a quick touch up for her. She's happy to go to work. So again, this is before, this is right after the emergency treatment, which not too bad. But again, I want to evaluate the inside her mouth. So much evidence of anterior wear and tear from the two teeth on the top touch on the bottom, wearing out is incisor here. Very clearly that there is a problem that if we don't fix it, it continues super erupt here and continue wearing out the enamel. And there's going to be a sensitivity and going to be a problem with the restoration. So we want to come up with something more permanent solution. As you can see, I mentioned to you that the art is off. There is something missing here. Let's see what exactly inside going on. So you look at the occlusal view, it's actually number 4 is lingually inclined. It's not that number 4 is missing, but it's lingually inclined. And you can see the arc fairly looking pretty good, but the rotation of this is to number 7, I believe, and lingually inclined here. And then on the bottom tube, as you can see, eruption of the, I want to fix this. I'm going to go back real quick here. Sorry for the mist. All right, I want to move this area so you can see better, but lower incisor are way crowded and not straight. This is the problem there. And you can see that also causing the posterior teeth with wear and tear occlusion because the bite is not in groove functioning. It's not lateral excursion of the canine guidance. There's nothing like that. So everything become a problem. So yeah, this is a very beautiful case to convince the patient to get braces. So anyway, you know where it is. If you watch this video to this far, please make a comment and you figure out, tell me where this picture is, this location of this view. I would appreciate if you make some interaction with me. Here is the picture of the what we do. We etch and bond and start braces on that day. On the following day after emergency treatment, patient came back with his study model and then set it up. So unfortunately, she chose to do the clear practice, which is the porcelain practice. I speak the truth. I know I spoke to orthodontists. None of us are in big fans of clear practice like this. It doesn't work well. It's complicated. It takes longer to repair and straight people teeth compared to metal braces. She chose it. She's very conscious about practice because she's had to talk to people. She's the boss. She doesn't want to have anything so in the metal. So I had to end up doing clear practice. I did not enjoy the process of doing this porcelain practice. It's very easy to come out. It's hard to move teeth, and it's really hard to put the elastic band on. Multiple problem. Whoever watching this, I encourage you that thinking about reducing doing this ceramic practice rather than choosing the traditional silver bracket would be much better. You watch this far, you learn something. And here we go. So again, we start with very crooked teeth. We did a lot of night tie wire, moving the teeth around, take a long time. Now, as you can see that, how come I didn't really start everything at the same time? Sometimes you might have to go one thing at a time because the interference of the bottom teeth can be a problem. So in this case, I don't remember how did I start it, but looked like we start at the same time. But we have to be careful because the deep bite with thick brackets, it may pop out too. So anyway, we started, we get to a point where it looked pretty good for comparing how she smile from here to this far, patient getting more happier. So now we look at the comparison between before we start and after we start. You can see that everything is in alignment. The teeth are in good shape. A lot easy for a patient to maintain her cleaning, self-clenching on the back teeth here. And you can also see that occlusal on the upper, we were able to move the number 4 inward, outward, and correct the occlusion. So everything turn to the way it's supposed to. The alignment of this tooth here, number 7, look a lot better. So this is before, and you look at this after. So, and we can also agree that the teeth are more on the proper one line align art rather than irregular of the art. So that's make a big difference when you put the teeth top and bottom together. So here's is another view. This is before, this is after. This is before, this is after. As you can see, I was talking about these are called super erupted compared to canine. We're trying to be somewhere right here. I wish if I had done with metal brackets, I would be able to move these down more, but because of the ceramic brackets, it's very challenging to engage, torque, and force to move teeth down, guys. So that's the reason why once we do this, I don't recommend crowded case for like crowded teeth like this for the doing the ceramic bracket, but I encourage you to do silver bracket. I don't want to do any advertise for any company, but I'm just letting you know this is the truth. Very difficult unless somebody recommend me a better ceramic bracket. You tell me on the link below, the comment below, so we can help other dentists and orthodontists as well. And so we can move on to more picture here. So this is after the treatment. You can see the deep bite is reducing. The picture look a lot better. The tube number 4, we were able to move them in a line. And again, this is before we start, right after braces done. This is more like the bottom, those bottom teeth are when the patient go into low mandibular protrusion. We can check the alignment of the incisor. And anyway, you can see the difference between how it will turn out from here to here and to here. The corner of the mouth, you can see bigger, broader smile on top. Patient look a lot better. She's a lot more confident of her smile. Here is before, and this is after. Before, after, and before, when these are the after. Anyway, this is the final picture. She's ecstatically happy and she's very confident now. She can be the big boss in her company. I wish you guys to continue subscribe to my channel, visit our channel. You can daily, weekly receive more video like this. I hope you enjoy it. And I want to thank you for those who subscribe to my channel. Please follow, make some comment. I appreciate your continued support this channel and get this going for the world. Thank you again for everybody watching. Have a great day. Thank you. Oh, got this one. Before and after. One more picture. Before and after. What a big difference. Thank you again. Have a wonderful night. Good night, everyone.